Very much, everybody, for joining us for our latest Clerks Network. Today's session is going to we're going to have a discussion around transformation and inclusion. That's going to be a discussion that's led by Dr. Tanvir and Sharon Thomas from Corsham Town Council. So thank you both of you for your time today. I'm pleased to say that we've got Teresa Strange on the call as well. So there'll be an update from the Wiltshire and Swindon branch of the SLCC. We'll have a chance sort of open Q&A with any issues or queries or concerns that you may have, a bit of an opportunity to sort of open discussion, and then we'll just wrap up with a conversation about the next networking session and the topics that you might be interested in. I'm going to let Tanvir and Sharon introduce themselves, I think, as part of the presentation that they're going to give. But I just wanted to say a very brief introduction to the topic of inclusion. I was fortunate enough to be involved with a conference that Tanvir organised in Corsham a few weeks ago, and I was very pleased that she agreed to speak at the WALC conference as well on this subject. I find the topic of inclusion not just within our councils but within our communities as really pivotal to the whole of the sector. This isn't just about Wiltshire and Swindon. And it doesn't matter how big or small your council is. I just think this is such a powerful topic, not just for the way that we relate to each other, not just the way that we relate to each other as councillors or as council officers, but also members of the general public, how we understand our community and how we engage with every single member of that community. For me, this is a very powerful piece. I'm an unapologetic convert to what Tanvir is going to talk to you about today, and it really is a lot of the sessions I hope you enjoy, but I really hope that you're going to join me after the end of this presentation in really being powerful advocates for what is such an important topic. So anyway, that's enough from me. So Dr. Tanvir Bush and Sharon Thomas, over to you.
Thank you very much, Ian, and thank you so much for allowing us to come and to talk. I believe at the moment the weather we're experiencing is called anticyclonic gloom. So it's hopefully this session will bring a little bit of light to that feeling of impending winter. Transformational inclusion. If we go straight into the first slide, this is just to give us an overview. We're going to be, Sharon and I will introduce ourselves. We'll do a little bit of background context, some talking about inclusion and exclusion. We're also going to look at the medical and social model of disability. It's a very useful model to have. It's not perfect, but it's a really useful model to have in your head when you're thinking about inclusion more widely. And then we'll be looking at talking about how we can do practical things in terms of access and inclusion. So next slide, please. So to introduce myself, I am a middle-aged white woman. I have no idea what colour my hair is at the moment because I'm registered blind, and one of the issues that I have with my sight is that my colour vision is going, which causes all kinds of confusion. But so I don't know. I think it's vaguely purple, but do feel free to let me know. I'm a kind of I've been a jack of all trades in my life. I've been a filmmaker. I've been a bingo caller and a waitress. I've done all kinds of things. But more recently, I did a PhD in creative writing. I became a novelist. and then was lucky enough to move into academia as a researcher. And I've been doing a lot of research around disability and community and how we as disabled people experience community. And as part of that, this last year, I've been really lucky to have been holding an NCCPE fellowship. It's called an Engage Fellowship, and that's the National Coordinating Centre for Public Engagement. And my role in that was to explore creative public engagement around this thing, transformational inclusion, at the intersection of disability, academia, and local government. And that kind of came about after I was working with the wonderful Corsham Town Council, and I was a local councillor for 3 years. And we were working together to kind of bridge some of the gaps that we were finding at that intersection. So what is transformational inclusion? It feels simple, but it's actually a very, very profound kind of switch in our way of thinking. And it's really hard to do when coming from a place of privilege. It's hard to do when as policymakers and as managers. It's really hard to do, to not be thinking so much about us and them, but all of us together. Not how can we help you? How can we help them? But how do we all help each other to embrace the possibility that every single person, if they're given encouragement and support, can actually partake in and give back to their local community in some way or another. And really experiencing profoundly without feeling restrained by ideas around finance and politics and expectation, but really having that open heart to really think about creatively about what's possible. So that's me. I'm going to hand over to Sharon to talk a bit more about Corsham and Corsham Town Council.
Good afternoon, everybody. My name is Sharon Thomas. I'm Head of Community Services for Corsham Town Council. Like Tanvir, I am a middle-aged woman wearing glasses and with blonde highlighted hair that costs me an extraordinary amount of money to keep up. Corsham Town Council, as I'm sure many of you are aware, is obviously in Wiltshire. It's one of around 10,000 local councils in England. We have a population of around 14,000, although that doesn't quite say 14,000 on that slide, I've just realised. We currently have 17 volunteer councillors, although we should have 20, so we currently have 3 vacancies, and also 18 paid staff, both full and part-time. And our budget, which is, I think, one of the older slides actually, our budget is currently 1.6 million, which puts us in the top 60 largest councils in the country by budget. Probably the most important thing to mention is that Corsham is non-political and has been for many, many years, which has always been a huge benefit as an officer and means that while everybody has probably their party political allegiances, it has never stopped our councillors from doing what's best for the town. We started looking at inclusion and supporting our disabled community when Tanvir was a councillor, and that work has continued in many different ways. Could I have the next slide, Ian, please? So our current strategic plan, which is pretty much coming to an end, and we're about to start working on our next strategic plan in the next few weeks, has community engagement at its heart. There is no point in doing the work we do if we do not include people, tell people about what we're doing, allow people to get involved. And our aim has always been to make life better in Corsham through equality, accessibility and inclusivity. And those are the 3 things that we really want to focus on. And as you can see from those stats in our community, from our last census, we have disabled residents, nearly 3,000 disabled residents, and those with long-term physical mental health conditions of around 1,500, which is probably around where we're at now, given that this was 4 years ago. So it's really important as a large number of our population to kind of care about those people and make sure that they feel included. And we've done that by creating a community engagement strategy that underlines all the work that we do. And alongside that, when we did the strategy, both the strategic plan and the strategy, we created easy read versions of both documents to allow anybody with a disability or with issues over reading to actually be able to engage with us. There's no point in creating a community engagement strategy that a percentage of your population cannot read or cannot access. So it was really important to us that we got those done and made them widely available to people and promoted the fact that we have them for those people that wanted to pick those up. Just the next slide, please, Ian. And this, for those of you who don't know, just puts us in context. This is actually the Corsham community area, so it's the area covered by Wiltshire Council's area board. But you can see where Corsham sits alongside Cologne and on the way to Bath, so from north of Wiltshire, and obviously Cologne, Box and Laycock are our area board nearest compatriot. Next slide, please, Ian.
Right. Thanks, Sharon. Going back to why do we use why was using the disabled lens so important when it comes to exploring wider issues around inclusion and access? And there's several reasons. One, because deaf and disabled people make up about 24% of our population here in UK and globally, and that goes that number goes up exponentially, obviously, as we get older. We're all living, most of us, lots of us, living for longer and experiencing different sort of morbidities and chronic conditions as we age, as an older population. However, we're also the largest minority group, but we intersect, and this is what's really crucial, with almost every other group in our communities and globally. So in every faith, you have disabled people. Every sports practice, every sports club, people have disabilities. Every school, disabilities. Every culture, disability. Disability, to be disabled is to be human. We are our bodies, and our bodies are vulnerable and can be fragile. And so we all experience at some point disability in our lives. However, that said, we are the most overlooked and underrepresented group. And this is crazy because it's quite hard to navigate the world with a disability because the world is not designed for you. So you have to become very engaged and adaptable and resourceful. And there are a lot of disabled people who are resourceful, adaptable. They're often quite tired, but they are amazing, and they have often have great potential, and for kind of unique ways of inputting into community and participating. Next slide, please. So this is our definition of disability, and I used Inclusion London, who are a fantastic deaf and disabled people's organisation in London. And I recommend you to have a look on their website. They've got lots and lots of fantastic resources for free. So using their definition, we use the term disabled people to cover all groups of people with impairment, including people with learning difficulties, people who experience mental distress, deaf people, people with visual impairment, people with hearing impairment, people who are neurodivergent, people with long-term health conditions, people with invisible impairments, and people with physical impairments. We recognise, and this is crucial, we recognise and respect that some of the groups in our definition do not think of themselves as being disabled, but we believe we are united by the disabling barriers that we face in a disablest society. So there often, you might have older people who are just, well, I'm just old, it's not to do with disability. Maybe potentially somebody, I have a colleague who, you know, who talks about having diabetes, but doesn't feel that they would feel themselves as disabled. So, you know, gives us a very general, all-round definition for disabled people. So next slide, please. And of course, you know, we are all going to experience disability at some point, as I said before. It might be through a sports accident or, you know, getting older. Some people might have a chronic condition for a while. But you can also be, if we look at society being the thing that disables us, we can be disabled by becoming a carer and therefore being unable to get to work and get out of the house because we're caring for somebody. We might be disabled by language, turning up in a country where we don't speak the language or can't read the language, or culturally we don't understand the culture. We can be disabled by poverty. We can't access education, we can't access the resources that other people around us can, or by technology. And we know this, that earlier today, I'm now on an iPad, which is not actually very accessible for me because my university, unfortunately, have put in new security, which means I can't get onto Zoom on my laptop. So technology, we can be disabled by technology as well. So if you think about all those different ways that we can potentially be disabled. Next slide, please. Oh, and this is a quote. I'm going to ask Sharon to read this. It's just a lovely quote from John Hume.
Difference is of the essence of humanity. Difference is an accident of birth, and it should therefore never be the source of hatred or conflict. The answer to difference is to respect it. Therein lies the most fundamental principle of peace, respect for diversity.
Thank you. Next slide. We just for a couple of minutes, I'm just really going to keep it short, but this is where you are very, please feel free to use the chat function or just to jot some stuff down or to shout out, but just have a think. What could go wrong, or what might we miss if we don't include our disabled or other minority potentially or potentially excluded communities? So just give a couple of minutes. And we'll come back to this discussion at the end. And I'm wondering, Ian, are you able to read the chat for me? I'm not able to see it.
Oh. Yes, I am. At the moment, we've only got one comment, and that is from Teresa Strange. And we designed some services that meet only the needs of some of the residents in the parish.
Okay, so just the one point. Let's move then on to the next slide. Thanks, Teresa.
Oh, I've lost my clicker.
You must have lost your clicker. That sounds painful, Ian. So critically, we immediately lose innovation and creativity if we don't have EDI. And we gain innovation and creativity if we do. So organizations that promote diversity and cultivate inclusive environments are reaping huge rewards in terms of innovation, better decision making, and better performance overall. The positive impact of diversity and inclusion extends beyond social responsibility. It's a strategic imperative that drives success and positions companies for long-term sustainability. And that's from Forbes magazine. You know, really, it can really power creativity and innovation. Next slide, please. And when we think about more specifically about, well, what about, you know, specifically more the disabled community? Well, then we look at the economy and the purple pound. And the purple pound is what we call our disabled spending power. So despite the economic challenges that many disabled people face, these households collectively have spending power of approximately 249 billion annually, representing nearly 20% of total household expenditure in the UK. The Disability Benefits Consortium estimates that disabled individuals contribute around 80 billion to the economy each year. These statistics underscore the substantial market opportunity that exists for businesses catering to the needs of disabled consumers. If our town centres are not catering to our disabled communities, we're losing money every day. Next slide, please. So these just a few points about housing, and again, this is a bit more specific to, this is kind of more to do with inclusive design. And if we don't design inclusively from the outset, then we're always retrofitting. And when we look at housing and the cost of living, 1 in 10, I think it's over 1 in 10 people in UK report some kind of mobility problem and are likely to need wheelchair accessible homes, but that's only 5% of homes in England can be visited by somebody using a wheelchair. 1 in 6 disabled adults and half of all disabled children live in housing that isn't suitable for their needs. And of course, disabled people will incur often higher fuel bills due to vulnerability to high and low temperatures, mobility aids, things like hoists or power chairs, and additional costs, diet, medical, transport, many things. I think there was an estimate that being disabled cost an extra something like £500 per month. So it's an expensive business having a disability. And there are lots of things around the benefit system which are problematic. And I'm not sure if any of you have endured doing a personal independence form, but you know, things like that, exhausting and difficult. And all those things that can be exclusionary or exhausting mean that disabled people are not actively active in their communities and actually having a positive impact in their communities. They're too busy trying just to navigate the day-to-day chores. Next slide, please. And of course, emergency planning. This is really important. Disabled people are twice as likely to die in an emergency, mostly due to bad communication and planning. And that figure rises exponentially for people with learning disabilities. We've got, obviously, we've been, you know, watching the horrors of Gaza and the Middle East, and all the kind of mass migrations of people. How much more difficult is that when you have a disability of any form? You become much more dangerous. And of course, during the COVID pandemic, this was proven to a disastrous and shameful extent, in that 6 out of 10 deaths were disabled people. Many of those were people with learning disabilities. But we as a community, as disabled people, we're still rocked by the residual fear of being disposable. Even though I am incredibly, you know, sort of strong and fit, because of my being registered blind, in that first wave of the pandemic, I probably wouldn't have been given a ventilator had I turned up in the hospital when, you know, sort of in a coma and unable to speak for myself. They would have just said, you have a disability, we do not resuscitate. So yes, next slide, please. So we're now going to just go through this rather useful social model of disability, which many of you will have come across before, but if you haven't, this is a really useful model to have in your toolkit. So I'm going to ask Sharon, she's going to just read the slide and do the medical model.
So social versus medical. The medical model, which we'll go through in a second, assumes that disabled people are somehow at fault for the challenges and barriers that they face. The social model was developed to challenge that concept and assumes that the barriers are societally constructed, and that if the barriers are removed, then disabled people will be included, and actually will open inclusion for everybody. You might not necessarily want to endorse the medical model, but it is quite endemic within society. They are not working hard enough. The building is old, we can't put a ramp in, and hybrid working won't work, which are all certainly not reasons to not include disabled people. If you do the next slide, please, Ian. So this is the medical model of disability, and a very long-standing model as well. So, which basically identifies that the problem is the disabled person themselves. So there could be housebound, confined to a wheelchair. They can't walk, they can't get upstairs, they can't see or hear, they're sick, they have fits, they need help and carers. And everything about that comes down to the fact that, as I say, the problem is the disabled person. The antithesis to that is the social model, which Tanvir is going to go through.
So the social model came about in the 90s during the disability activist movement. It was an academic called Mike Oliver who designed it. It's not, as I say, it's not ideal, but it's a really good starter for 10. So the social model of disability states that the oppression and exclusion that people with impairments face is caused by the way society is run and organized. So the problem is the disabling world. So the problem is poor job prospects. The problem is badly designed buildings, stairs, not ramps, not lifts, special schools, few sign language interpreters, discrimination, inaccessible transport, isolated families. Those are the problems, not the people themselves. So that's just one way of looking at it and looking at the world. And a lot of disabled activists will immediately use the social model of disability when they come to their activist work. Next slide, please. So we're going sort of to talk a little bit more about how we make our local councils more accessible, what's possible, what kind of potential. We've got lots of different areas that we can work within, the information that we give out, the training that we give, the buildings that we work within, the events that we run. And if we go to the next slide, I want to talk a little bit about an event. It's the one that Ian mentioned. You all right to move to the next slide?
We've got it's the Place at the Table Symposium, September 25th, or did you want
that
me
one?
To go?
No, that's
the right
perfect.
one, is it?
That's the one. Thank you.
I was a bit quick on the draw there.
So a place at the table symposium. This was a collaboration. It was a really super collaboration. So we were working with NCCPE, with Bar University, with Corsham Town Council, Wiltshire Association of Local Councils, Web Usability, the National Association of Disabled Staff Networks, and Wiltshire Centre for Independent Living. And we came together for 3 days, 2 days of in-person and 1 online. We had presentations, we had workshops, exhibitions and discussion, and it was all held at the Pound Arts Centre in Corsham. And the idea was to kind of start imagining what would a manifesto for inclusion for Wiltshire be? What would it sound like? What would it feel like? Next slide, please. So it was really important how we structured the symposium to make it as inclusive and as welcoming as possible. So we wanted it to be both inviting but very absorbing, but allowing flexibility, which meant we needed to have free flow of movement around the venue. So you could move from different spaces. You could go into and out of workshops, into and out of presentations. There were, you could move to exhibitions or audio, or you could go and just sit outside. There was lots and lots of free flow and lots of opportunity for discussion. It was really important to make it free, and to cater it was really important. Obviously, that it can be very exclusionary to have paid events that people can't access. We had lots and lots of breaks, and we had multiple methods of discovery. So this allowed kind of imagination and creativity. So we were using things like movement. We had a bit of dance. We had kind of flip charts and plasticine and art and all kinds of stuff going on all over the place. And we are still in the process of extrapolating and evaluating all the different things that came from the 2 days. So the next 2 slides are just a couple of photographs from the event. The first slide is the wonderful Dan Wilkins and the Pioneers. The Pioneers are a group of disabled people who are working together to kind of collaborating with Wiltshire Council, and Dan is an innovator from Wiltshire Council, and they gave a fantastic presentation on collaboration. And then there's another picture which is just an arty-farty photo of the movement session that was really lovely. And that's for Ian. Next slide, please. So now we kind of going to go through a few ideas and then kind of really open the floor really for discussion. These are just some of the ideas, sort of things that can be done. First off, critically, real consultation and collaboration. It's really important, and having and embedding time, allowing for time for real consultation and collaboration. Obviously, inclusive design from the outset. If you're having to retrofit things, it's really expensive. Accessible high streets. How do we do this? Accessible toilets. Making these our centres inviting and welcoming. So having, sort of lots and lots of disabled parking, for instance. Are our websites accessible? When we did, sort of the program for the symposium, we spent a lot of time thinking about was it accessible to screen readers? Was it comfortable for people who were neurodivergent? Using easy read and plain English. Easy read, as Sharon mentioned it before, is a simplistic sort of written form, which also uses emojis and pictures. And I can promise you that if you have easy read, sort of summaries of reports, everybody will go for the easy read. Everyone likes easy read. We've all got lots, we're all very busy. Easy read is really helpful and useful for everybody. Makaton and BSL training, really good signage, lots of safe spaces. So I'm thinking if we maybe close the slides and open to the group, and I'll pass back to Sharon and David to maybe talk a little bit more about what we've done in Corsham.
I can just whiz through, or we can just whiz through some of the things that we've done. As we mentioned, with the community engagement strategy, we produced easy read versions of both the strategy and our community engagement strategy. We also, from the point of view of our community awards, which we run every year, we created an easy read version of the community award form. So, and again, as Tanvir said, a number of people use that form, not necessarily just the disabled community, to be able to take part and to nominate people that they wanted to be included in that scheme. From the point of view of accessibility, we're also currently working towards being an age-friendly community in Corsham, and a lot of the work that we do crosses over into the kind of disability access side of things as well, and that incorporates our toilets, it incorporates benches, incorporates good routes into the town through accessibility audits. So a lot of the work that we do will, for the older community, and actually age 50 plus, according to the World Health Organization age-friendly limit, will cut across that. And as Tanvir said, as we grow older, more and more of us are likely to have some kind of disability, and it brings us into that community. So the work that we do crosses over into both, and vice versa. The work that we do towards supporting our disabled community also is a benefit to everybody. You are making changes that will help the whole community, not just that section. We are in the process of making sure that our website is fully accessible to everybody. We have undertaken some very basic but some good fun Makaton training with counsellors and staff, which we'll probably return to as we increase our staff numbers and we have a change of counsellors. And we're also looking to do dementia friend training at some point soon for everybody again, and also to invite our businesses to see whether they would also like to undertake that, because with an ageing population, and we know that everywhere is an ageing population as we all live longer, better lives, then these things become more important and are also very useful to neurodivergent people of all ages. So for us, it's kind of a vital thing that we do. And we also, since the pandemic, have also created a community wellbeing officer role. And although her role is not just for disabled people, a lot of the work that she does with our local groups and organisations means that she's making all those contacts and is able to facilitate a lot of work between the groups. So we're not actually doing the work ourselves, we are encouraging other groups who are already there to broaden their remit or to work together or just to introduce them to each other, because they don't actually know sometimes that there are other people out there. So from a facilitating info sharing kind of role, it's proved invaluable over the last 3 or 4 years, and that will only increase, particularly with our age-friendly work and our work towards supporting our disabled community. So we've done quite a lot, but they're all quite simple things, and a lot of them are free things to do. They've not incurred any cost to the town council, but the benefit, as we said, is just invaluable.
I think from my point of view, it's a bit like we were thinking about environmental or climate change as sort of cuts across everything we do, and pretty much every council is thinking the same thing now. When you're preparing a report or trying to design a new service, you always think about the impact on your sort of carbon footprint and such like. And this should be thought of in the same way, really, about accessibility, thinking about how does it impact on people who are disabled, and trying to sort of bring that into it as well. So if you're writing a FB report, you always put a paragraph in on environmental implications. There should be also something on accessibility as part of that. So that's where we're sort of coming from our sort of strategic level.
Thank you. And one of the other things that I learned from the symposium was that our deaf community will not attend events if they won't sign up to events that are not signposted as BSL, or so I made that mistake. I just assumed that people would, you get the forms asking if you've got any reasonable adjustments that you need, and I just thought, oh well, people will say if they need BSL, but actually that's not the case. So that was something I learned, was that actually I need to put on, if I'm going to have people signing and BSL interpreters, I need to put that on from the outset, and that immediately you will get your deaf community involved. So we're learning all the time, and don't have all the answers yet, but we've got a few. So I think that's it. That's kind of open the floor for questions. If anyone has any questions.